Thank you very much, Fiona. That was a very kind introduction. Makes me feel old, been in all those things that have happened. So welcome to Western Health, and thank you so much for coming. I'm really grateful to see so many wonderful familiar faces. Makes me feel much more comfortable up here. But I guess today I'd like to take you on the journey that Western Health has been on in environmental sustainability in healthcare. And I was, in thinking about it, I guess it's been in 3 phases. So I really have to thank, I don't think he's here at the moment, but you'll meet him later in the day. Forbes McGain is an ethicist here at Western Health, and has worked solidly for a decade really to move this organisation forward. So I wasn't the instigator of this journey, but I was certainly very happy to join him on it in about 2011 when I was employed here. So yeah, I'd like to talk about my kind of 6 years on that journey together with Forbes, and taking lots of new people with us along the way. And the third phase has been more recent, where I've kind of come to the organisation in a period where there wasn't a strategic cycle, 2011. So then in 2015 had a chance to kind of really try and embed sustainability more into that strategic system, which we all need to operate in. I guess. Yeah, sure. It's probably worth saying, as my experience as a clinician was one of great tension in trying to be a greenie and a clinician, and the really big impact that healthcare does have on the environment, and what a tension that is for clinicians. So that was very much my experience, and trying to work to do simple things like put recycled paper in the printer or redesign dressing packs in the emergency department and things like that were actually really difficult and got me quite marginalised in that role. It was, tree hugging hippie, shut up, just not interested. And the people who did try to help me, I didn't actually realise they were trying to help me because they were saying, you probably need to sit on this committee or do that or go there. And I actually thought that was kind of obstructive to have to move through a committee, or it's just easy, we should just do it, but so I'm speaking to both the clinicians and the people in the hierarchy of hospital life to say that you can make change, but you do have to follow the systems that are given to you in the hospital setting, and that includes for clinicians. You might just be working on, Andrew's a great example, loves to make great changes here at Western Health, but I'm always kind of goading her through vessel systems where we have to do it this way and we'll get there. But yeah, there's ways that I didn't realise in that mode. So I'm going to use the CAHA and GGHH's model because I love it. It's great, well done, and talk about our journey through that model. So did I do that one? Yeah, I did that one, sorry. So the first few years was really about developing governance. So we formed an environmental sustainability committee, and we had decision-making powers on that committee rather than having just clinicians and people who are interested. We kind of got a few executives and got a bit of buy-in, got an executive sponsor on that committee, and were able to really talk seriously about what was needed to see those changes progress through the organisation. And I guess some of the things we do in this space is yesterday we had our Green Ward competition. This is our second year of offering $1,000 to a project that makes good environmental outcomes or has the potential to make better environmental outcomes as it progresses. Grace Wong, our fantastic pharmacist, is here today. She and her department took out that prize yesterday for some great work that they are doing. So I guess that's a yay! she's going to speak to you later and tell you all about it, so I won't steal her thunder. But we do have a calendar of events. We have National Tree Day, where we generally, probably 40 or 50 of us get out and plant trees in. It's actually my favourite project of all. We actually get into nature and value biodiversity and all the things that I really care about. On the Stony Creek, we've got a nice riparian zone down there that we plant 1,000 trees a year, and it actually, preparing that site in the morning and in the week prior, seeing, more birds come, and, that is making a real difference is wonderful. So we get to things like that, which is very pleasurable for me. And we have Waste Awareness Week. Daniel's often support us greatly on those kind of campaigns to help our staff to recycle correctly and do the right thing with waste. Forbes, you'll hear from later, really drives some fantastic environmental research here on life cycle analysis, so that we can kind of compare reusable with single use and have a real discussion about what the triple line impact of those is. And he'll reveal to you that it's really interesting. And you actually just don't know until you do those kind of studies what you're going to find. So more about that from Forbes. And I'd like to do this forum annually. I don't know how CAHA and Institute of Hospital Engineers feel about that, but I'd love to do this because I've learnt so much yesterday, and really love the dialogues that we're going to have today too.
And we're up for it.
Yay! Okay, so yeah, and just something to acknowledge, I guess, along the way is that has been a real learning is communicating with staff, and it's been a recent learning really about how the potential of your staff groups and all their passions, and if you can kind of facilitate them in some way, they are such a fantastic asset in this journey. So what have we been doing? We've chemicals. We've managed to reduce our a lot of waste, and 80% of waste, from moving into a contract where the criteria was about reduction and efficiency, metered dose kind of measures of chemicals used as needed, as opposed to kind of that kind of easy dosing. We've got e-water. I don't know, does anyone need to know do people know what e-water is? It's a kind of an ionising of regular water with salt, so that you get a slightly acid and a slightly alkaline solution that can be a sanitizer or a cleaner. And so we've lucky enough to pipe that into our kitchen renovation at Sunshine Hospital, and are able to displace a lot of chemicals by using that. It's quite a commercialised system in restaurants too, so that's been really good. Waste, we love waste. I love waste. I love diverting it from landfill. I think we've got about 20 or so more probably recycling streams, and so they move from the very obscure to the very obvious. Things like, actually I think I might have a list of them. Come back to that one. So the regular commingled ones that we do at home, but then I think Liz Lightly might be here somewhere, has pioneered something with the peel pack, the aluminium peel packs out of the suture sets and blades are a bit like printed metal on the Coke cans, so they can be diverted from landfill and recycled. So we collect a big bunch of those. I think her husband designed a paddle so that you could kind of squash them safely and make them into a nice aluminium brick. Which is fantastic environmentally, because aluminium, to make it from virgin and make it from recycled, I think you save about 95% of the electricity associated with producing it. So it's a great project. What else? We can thank Forbes again for the invention of the PVC program, which I know a lot of you have kind of taken up. and he worked with a local recycler just to identify 4 simple items: IV bags, face masks and oxygen tubing, that recycler would say, yep, I could value add that to my production line and use it as a feedstock. And then working with partners, Baxter and the Vinyl Council, we were able to kind of leverage that and offer it, because of being such a simple program, we can kind of make it more public. And it's been taken up very broadly. I think 60 healthcare networks around the world have now decided that they could probably do that too. Africa, we got a query from recently, which wondering about HIV and PVC, and it's kind of, wow, it's in Africa. That's awesome. That feels good. Anyway, I know that a lot of you people are doing those projects too. So we love waste, and that's that one. This is just a picture of when we wondered how much sterile wrap we produce, and we didn't really know what to tell the recycler how much we produce, so we just let it build up for 3 days. Oh, bring the truck, quick! Getting into trouble. But this is the kind of thing that's made into, which is wonderful to put out, and have around your organisation, showing the good work that theatre staff and CSSD and all those nurses are doing. Moving on. I really like this program too. It's with Donations in Kind, a local organisation who have got a factory kind of warehouse locally in Footscray, and we don't need to have someone who needs our equipment or supplies. They've got a warehouse, and it's an amazing operation. I wish I had photos of the factory, but I guess there's some a little bit. But anyway, it's just a really huge operation of moving healthcare materials to a third world need. And so, they take things for free as long as things are in good working order and can be reused. They take them, which is a great favour to us, because it's good news. Energy. I learnt so much about energy yesterday. It was really good to get a real foothold into where we need to go to get towards what Scott's talking about worldwide. I think Victorian healthcare is a little bit hemmed in by its accounting system, and not being able to kind of borrow that 25 million to get that 4-year payback, or it's really not on our horizon unless we're in an energy performance contract, which is permissed by the Department of Health. So we do have challenges that obviously other places don't have. So I think that's definitely a place that we should all be politicking for change of our accounting system that enables us to do these newer, legal and financial models that can help us to pay back things out of the savings. So we've kind of followed that marginal cost curve of LED lighting. That's a good payback. We've done it with sleep mode on computers, zip boil kettles, seasonal swings, played with the BMS a little bit. We're certainly always looking for ways in research and putting in wireless metering and trying to understand how we could make a business case internally rather than relying too much on consultants. It's hard to justify spending tens of thousands of dollars on consultancy to confirm the business case, but knowing that the business case is there now, I think it is actually worthwhile. And things like the VEET scheme and other things that we were hearing about yesterday, solar and solar thermal and things like that, it's definitely worth developing these projects because the payback's there for sure. Forbes will tell you more about his energy research on particularly some of those projects. The one that we're most excited about, and I think we're choosing a supplier this week, is putting solar energy, 300 kilowatt system of solar electricity on this site. So that's fantastic. This is trying to get with the 2020, you know, we're going to get there. I'm not, you know, I guess the other thing that I'm very committed to is developing that energy plan. You know, really want to see that, you know, hopefully if we have this discussion again next year, keep me to it, that we're going to have an energy plan that will take us through to that reduction, decarbonisation. Water, we've done some shower and tap fittings, as probably everyone has. We have trouble finding leaks, but we certainly try and identify them very quickly. We do take a lot of harvested water, particularly from dialysis, and put it to the gardens, a little bit into toilet flushing. Certainly going forward, we'll be doing more of, when we're building, to actually move the water into toilet flushing rather than and reducing the potable water coming out of use for operations. In operations, not on operation. Transportation, we do have a bicycle user group. We have a fantastic champion who takes rides in Europe a couple of times a year, so she's really gun rider and kind of creates a real buzz around cycling at Western Health. It's not a huge group, but it's a very active group, and we're very lucky and to have that kind of leadership, where they have championed getting end-of-trip facilities and having a bit more, they've had a little bit of political force in the organisation, which is great. And we do have the opportunity, there's a couple of opportunities really coming up in carpooling. Carpool the West is something initiated by the local council that we've been able to be part of the pilot of, and we're very likely to have an online carpooling opportunity secured very soon. Food, I get depressed about this subject. Food in healthcare, it's terrible. You know, it's not where it needs to be at all. I don't know what the solution is really, but we do take plate waste and turn it into compost and do our bit in that way. So the Gaia unit is kind of like a dehydrator. You put all your plate waste into it, maybe about 100 kilos a day, and it turns into this lovely kind of rich soil amendment that you can dig through your garden, and we give it to an olive farmer in the Yarra Valley who is delighted. It really helps his olives be fabulous, and so that's a good outcome. But it'd be, you know, if you look at food and health, I think there's just such big opportunities to do better in people's well-being and much more service to our patients in that space. That could also be serving the biodiversity of our land and soil, and there's so much more we could do there. Thank you to the Department of Health coming online with an organics project that is likely to address some of these, you know, that side of the equation when you're